Hi, this is Jay Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. I'm pleased today to welcome my friend and colleague, Dr. Jon Epstein, for a weekly episode called Inside Bird Flu, where we discuss the latest news about the H5N1 epidemic occurring here in the US and elsewhere around the world. Thanks, Jon, for joining me today.
Hey, Jay. Thanks for having me.
Yeah, no, it's always great for us to catch up on this topic. And I hope the viewers out there, obviously, if you're watching this, you understand how important this epidemic is. And today I wanted to discuss an article that came out in Science magazine, and it's actually one of my favorite sort of science journalists, Kai Kupferschmidt, who's I think really excellent at covering virology and the emergence of new diseases, and especially the area that you and I care about in particular, which is how the environment, animals, and humans all interact together. And he wrote a really nice review article in Science, and people can find it in the description of this video, about it's about a 1-year anniversary since bird flu went from primarily being in birds and other forms of wildlife to spilling over into dairy cattle. And for viewers out there, I wanted to start, kind of a question to you, Jon, about why is it such a big deal that this H5N1 virus that we thought was primarily a disease of, migratory birds and backyard chickens and farmed chickens, why is it such a big deal that about a year ago we discovered that it was also infecting cows, particularly dairy cows?
Yeah, and before we even get to this, I want to just echo your sentiment and shout out to Kai. He's an excellent science journalist, and he's one of those rare journalists. Number one, he has a background in molecular biology, so he understands a lot of detail in science, but he just has a great talent for boiling down complex scientific issues to make them understandable. So I think he did a great job, as always, with this article too. In terms of understanding how bird flu even got into dairy cattle, it's so interesting. Bird flu, and H5N1 in particular, has been on scientists' radar for decades. We have seen this virus act up, infect poultry all over the world, primarily in Southeast Asia, parts of China, and occasionally lead to human infections and death. So this has been one that we often think about as a real pandemic threat, because right now, spillover from animals, particularly birds, into mammals like people has been pretty sporadic and is fairly rare. And so the concern was always, what if H5N1 acquired the ability to more easily jump from birds into mammals and spread among people? That's really the key formula you need for having a pandemic virus, is that it has to be able to efficiently spread. So far it's been sporadic, but what we see now in the United States is this pervasive infection of dairy cattle. And we are still uncertain as to exactly how it got into dairy cattle. Now, it's important to understand we have had outbreaks in our poultry for the past year or two. And so this virus is circulating widely on poultry farms in the United States. And so the presumption is that either there were farms that had both poultry and dairy cows, and perhaps workers either were infected or were carrying infectious material on their clothing perhaps, and then had contact with cows, and that was an opportunity for cows to get exposed. Sometimes equipment in the milking parlor, if it's not cleaned entirely, could be a conduit for infection because that machinery goes from cow to cow as they're milking. The point is, we don't understand entirely how it got into cows, but what we've seen is that it is showing up on every dairy farm in the United States, and we have big dairy farms. So it is a real problem.
Yeah, and I think, to really emphasize this for the viewers out there, I mean, what makes this so worrisome is it basically means that bird flu is one step closer to us, right? If this is a virus that's primarily infecting, wild animals and things, obviously there are pathways for it to get into humans, but on a day-to-day basis, many of us are not interacting with them. But there are opportunities. Now, however, the more it gets closer to our food supply, so milk, cheeses, dairy cow, when they, sort of outlive their usefulness as dairy cow, are turned into ground beef. The closer it gets to our food supply in different parts of our food supply, not just chickens, that's where the risk, starts to get greater and greater.
Absolutely. There have been a lot of studies now looking at milk and to see whether this virus is transmitted in milk. And indeed, milk samples tested from these different dairy farms do have H5N1 virus in it. But right now, our best understanding is that it is not a risk if the milk is pasteurized. And this comes to a really important point, is pasteurization, which is a process that was invented more than 100 years ago, was meant to kill germs, to kill bacteria. And it also, kills viruses, makes them unable to cause infection. So while H5N1 material is detected in milk, if the milk is pasteurized, it is safe to drink. Unpasteurized milk, the risk is really unknown, and that potentially allows an opportunity to get infected if you're drinking unpasteurized milk that has H5N1 virus in it.
Do you know much about cheeses at all? What about like unpasteurized cheeses, which are obviously pretty popular as well?
Yeah, I would think that anything in a raw form that uses raw milk could potentially carry some risk. And I don't know, I haven't seen all the data on whether cheese itself, presents a risk, but I assume it's fairly low if it's pasteurized, and then unpasteurized cheese might have a marginally higher risk. But I haven't seen yet data, and there haven't been infections yet linked to consumption of cheese that I'm aware of.
Yeah, I mean, there are all sorts of bacterial infections, as we know, that commonly get transmitted through raw cheeses, whether it's Listeria or Brucella, and
Right.
occasionally things like Campylobacter and other enteric pathogens. So it wouldn't be surprising, obviously, if viruses could survive that process as well.
That's right.
So one of the mysteries that Kai tries to explore in this, although it's probably a mystery what the exact cause is, but we know that there are probably a lot of reasons. One of the mysteries he tries to tease out in this article is, why is it that Europe, which, Europeans drink a lot of milk, they eat a lot of cheeses, why aren't they seeing this same type of degree of outbreaks in dairy cattle that we are here in the United States?
Yeah, it's a really interesting question. It's important to understand that this virus is also present in Europe, but they are not seeing cases on dairy farms. Now, there was a sheep that was recently detected with H5N1 infection in Europe, and these animals are susceptible. So experimental studies have shown that dairy cows in Europe can get infected with the strain of H5N1 that's circulating there, but they just haven't. And so some of the speculation as to why there might be differences come down to the farming systems. In America, we have more open farming systems. Dairy cows are more exposed to the environment. They're not totally indoors in a controlled environment. They're on big farms. There might be poultry on those farms. So this comes down to what we call biosecurity, the ability to control infection and transmission among animals on a farm. And that very much involves the workers on the farm as well, disinfecting clothing and boots when you go from one area of the farm to another or from farm to farm. And there are people who work on multiple farms. In Europe, the dairy system is much more enclosed. A lot of the cows, or most of the cows, tend to be kept inside buildings that are very heavily controlled. Biosecurity is, very strict there as well. And that may account for why we're seeing a lack of transmission into cows or circulation among cows in Europe. But they certainly are vulnerable and would be susceptible to the virus.
Is there anything about the scale? I mean, I haven't been to dairy farms in Europe, but obviously in the United States, these are like industrial type production facilities. They're not sort of what you always think, what you might romantically think of as like, oh, I've got 2 cows in the backyard that I milk. So do you talk about the scale?
I mean, a general trend around the world is the intensification and industrialization of farming. So while there still are backyard farms in that kind of romantic sense, and they're beautiful, we also have these massively scaled cattle and dairy farms. And in the United States, that's been the trend over time. The small mom and pop farms are starting to disappear that you used to see in New England and upstate New York, and in the Midwest. And we're seeing more and more of these massive, thousands and thousands of cows on one location. And while that is economically more efficient in a lot of ways, it leaves us really vulnerable. It leaves our food supply really vulnerable to disease outbreaks, because a disease that gets into a massive farm has an enormous number of individual animals to infect. And so they tend to spread like wildfire.
Yeah. And so there's talk in this article, one thing we haven't talked about, we've talked a lot about like the animal and environmental factors and the process factors, but what about the virus itself? Kai goes into some of the discussion about the different genotypes, B313, D11, and virus adaptation. What does all that mean? Why should people be worried about a change in the virus during this process, as opposed to just simply, oh, there was just a wild bird that, dropped something, dropped their feces, and that's how it got there? Is there something about the virus that we should be concerned about? And why are we tracking these sort of variants of the virus so closely?
Well, the way that people who study flu viruses think about these viruses is really by constructing a genetic family tree, and they track different lineages of flu. And that's because flu in particular has the ability to change very rapidly, very dramatically, because it has the ability to swap genes when it encounters other flu viruses. So for example, all of the flu viruses that infect people originally come from wild birds. And sometimes those viruses get out of birds and into animals. And we think of pigs as a classic example of an animal that can be infected by avian flu viruses and also mammalian flu viruses. And so they become what we call a mixing vessel. They can be infected by multiple types of flu viruses. Those viruses, when in the same body, have a chance to exchange genes. And that leads to rapid change and evolution of the virus. So flu viruses change quickly compared to other viruses, which is why we have seasonal flu that we have to track every year and adjust our vaccines to it, because it can change from year to year. And so with H5N1, which is a particular type of flu, even within that type of virus, there are genetic variants or variations as the virus evolves. And this goes back to the concern we've always had, is that so far H5N1 has historically been limited to birds, and it doesn't have the genetic wherewithal to easily spread to mammals and spread among mammals. But that is now starting to change with the realization not only that it's in dairy cattle, but we have seen massive wildlife infections and die-offs, particularly sea lions and seals all along the coast in South America have been infected by H5N1 virus that presumably came from migratory birds, and it is moved through mammalian populations. And there's certainly transmission going on among these animals. So every time the virus has the opportunity to infect a mammal, it has the opportunity to adapt to that mammalian system and indeed become better able to infect mammals. So that's why we track the genetic lineage of these viruses. We're very aware of the types of mutations required to make this virus more contagious among mammals. And so we're watching carefully to see if that's happening. Now, having said that, the slightly different lineage of H5N1 that occurs in Europe is not functionally very different than the one we have in the United States. So it is still capable of infecting dairy cattle if given the opportunity. It just hasn't yet.
Yeah, I mean, I think one of the things that really, I think, worries the two of us a lot here is also the fact that even though there is this tracking of viral evolution, that tracking depends on something very simple. That depends on the ability or willingness of people working on farms who operate these farms to allow testing to actually occur there. Yes. There has to be testing of the physical environment. There has to be testing of healthy cows. There has to be testing of sick cows. And there has to be testing of humans, both those who are sick and those who are not sick. And we know that this is a real problem. I mean, if we just think about basic human behavior, if your life depends on your ability to have your cows produce milk and sell that milk, and a lot of your workers are not legally here necessarily in the United States, or maybe they are legally, but they're still worried because there's, a lot of them are immigrant laborers as well too. They're just worried about being investigated. There is a huge amount of reluctance to do enough, just simply taking specimens. So that's one piece of the problem. And then the second piece of the problem is, as we sort of start to hollow out our public health system with all these massive cuts that have been occurring to every government agency, this is specialized testing. It doesn't just happen at your average veterinary clinic lab. This has to be done in very special laboratories, and the people who do these analysis have to be highly specialized. So I'm really worried that even though we have this information now, we're really only seeing just a tip of the iceberg, because there aren't enough specimens being collected, and the types of testing that from all different types of humans and animals and environments, and we're not getting the actual testing done that we really need as well too, in addition to the specimens.
It's a huge dilemma in public health, particularly when it comes to livestock and agriculture. They're so economically vital to farmers, and they run on razor thin margins. And there is a real perverse disincentive to test animals and test workers. Farmers know that if they find an infectious disease, in their herds that could infect people, those herds tend to get slaughtered. They have to depopulate the farm. That's a standard control measure. And that means economic loss. That means loss of livelihood. And even though the government compensates for some of that, it's pennies on the dollar. So there's this real disincentive to test. In America, the USDA has been reluctant to mandate testing on all farms. It's been slow to come because there's real pushback from farmers, but it creates a real problem, as you were mentioning, that there's economic disincentives, but there's real public health reasons to know what's going on. And we have to stay on top of this.
Absolutely. And I think this is actually a great place. I wanted to transition to another point related to this, which is that But let's really emphasize and hit this point here. This is why public health exists. And we saw this great, incredible, and I'll just say it quite clearly, horrific massacre that occurred on April 1st, metaphorical massacre of public health workers across all of the Department of Health and Human Services. And public health exists because there is a market failure. As Jon just pointed out, there is an economic disincentive for farmers to do this much of testing unless everybody is doing the testing, right?
Right.
The reason we have public health is we need to kind of level the playing field so that everybody who's involved in this important process, making the food that we all love to eat, is following rules that also keep us safe. It's the reason we have to, pay for police out there, because we can't guarantee that everybody's going to be kind and nice and not commit a crime. Well, the same is true with the rules of food production. And so we need this infrastructure. We need the humans that work on this, from collecting specimens to inspecting farms to testing the specimens and to doing the research on it. And, one of the saddest things I learned this week across all of the news that happened is that as part of this massive purge that occurred in HHS, Health and Human Services, multiple veterinarians involved in bird flu at the FDA were fired. And this includes the co-lead for the bird flu response. So just to make this very, very clear before I turn it back to you, Jon, this is basically the people that are in charge of making sure the milk that's coming from these farms doesn't infect our regular milk supply and doesn't infect our cheeses. These are the people that do that testing and do that inspection and monitor this. And they've now been fired.
Yeah, it's a huge loss at a time when we need that capability the most. And that's what's really worrying. There's two important elements to really investigating and controlling this bird flu outbreak. The U.S. Department of Agriculture needs to be on farms testing cattle and poultry and understanding the extent to which this virus is spreading. And the FDA, as you mentioned, keeps us safe from the food. And we need to know that our food supply is safe. And so losing the scientists from these positions will limit our ability to test. I mean, these are the people who discovered that pasteurized milk was safe, that raw milk is potentially unsafe. And if we don't have that information getting out into the public, we're more likely to see human infections down the road.
Yeah, no, absolutely. It's a real cause for concern. And so, I guess just closing up here, I think the main message for our, viewers out there, if you've been watching here, is obviously from a food safety perspective, as always, really, really just make sure that your milk products are pasteurized. This is not a time to be experimenting with raw milk, because we're in a much more dangerous time. And then number two, I would say that if you are as upset as we are about these cuts that have occurred to the staff and the programs that are keeping us safe, make sure you say something to your representatives in Congress and even your state and local people as well, too, because there are things that state and local health departments can do as well to help at least address some of these gaps.
Absolutely. It's important to stay informed, stay engaged, and really keep track of what's going on, because the information is coming out fast. And I guess that's why we're here too, is to help distill some of that information as it comes out.
Yep. And that's a great way to close. So if you enjoyed this episode of the Thermometer, especially this weekly segment that we have on Inside Bird Flu, please hit the like button, please hit subscribe. And we look forward to talking with you next week and bringing you the latest important news about infectious diseases and public health here in the United States and around the world. Have a good day.
Bye-bye.